So what are the signs which we should be watching? Sometimes people will have just confusion. All of a sudden they will be confused, and sometimes they are just numbness, only in one hand or two hands. So numbness is the one of the reason you will see that sign. And sometimes they will stop speaking. Speech is the problem. So I've seen many patients who will have just sometime a stare. They will not have any sign, but just a fixed stare. That can be a simple sign. So we should not miss any signs. If we catch the stroke on right time, we can save people's life. We can save their ability to live the normal life. I recently had an incident in my own family where the person was having just stroke symptoms and was taken to the hospital on the right time, and life was saved. No symptoms, no side effect, no after effects of the stroke. So taking care of the patient on right time is extremely important in stroke. Time